Welcome! In this educational offering, we will be reviewing key concepts in performing the NIHSS during a telestroke consultation. The NIHSS, or the National Institute of Health Stroke Scale, is a standardized assessment tool. It provides a qualitative measure of neurologic deficits when considering acute stroke treatment with thrombolytics or thrombectomy. The NIHSS is designed to be a simple, valid, and reliable tool that can be administered at the bedside consistently by physicians or nurses. It also provides a common language for information exchange between the spoke and the hub and a stroke system of care. We will cover two scenarios in which a telestroke provider and nurse will collaborate to assess a patient in the ED who has arrived with stroke symptoms. In the first example, we will demonstrate an NIHSS on a patient with a normal neuro exam. And in the second scenario, we'll perform the NIHSS again, but on a patient with stroke deficits. At the end, we'll highlight options and assessment techniques that can be used to optimize the assessment depending on your patient. A suspected stroke requires urgent evaluation. Engagement with your telestroke provider should be done as quickly as possible to ensure expeditious treatment with thrombolytics. It is worth noting that this education does not go over scoring, nor is this a substitute for full NIHSS certification training. During the first scenario, we will be demonstrating completion of the NIHSS for a 40-year-old male who presents to a critical access hospital with left-sided weakness. He reports this lasted about 30 minutes and resolved before arrival. A head CT was completed and shows no hemorrhage. The video will start after the nurse has placed the cart in the exam room and has activated the telestroke consult.
Hi there, I'm Dr. Wheeler. I'm a stroke doctor at the University of Wisconsin in Madison. The ED doctors asked me to examine you over the video today to help figure out what's causing your current problems. Is that okay with you?
Yes, yeah.
Great. Could you please tell me what happened that brought you into the emergency department today?
So this morning as I was getting ready for work, I noticed I was having trouble using my left arm to button my shirt. And then my wife also noticed that my face was drooping and my speech was slurred. But by the time I got here to the emergency room, everything seemed back to normal.
Do you remember exactly what time that started and how long it lasted?
I noticed the arm weakness at about 7:30 this morning, but it improved in the ambulance here, and so it lasted about 30 or 40 minutes.
Okay. I'm going to check out a few things on exam, if that's okay. Could you tell me what month it is this month?
It's January.
And how old are you?
I'm 40.
Could you please close your eyes for me? And open your eyes. Great. Can you make a fist for me? And open your fist. Good. I'm just going to zoom in a little bit and take a look at your eyes. So if you keep your head nice and still, just with your eyes, just look a little bit over towards the right. Good, and look over towards the left with just your eyes. Good. And then Nikki, could you help me check the visual fields?
Yeah, you bet. So what I'm going to have you do is look right at my nose, and I'm going to hold some fingers up. Tell me how many fingers I'm holding up, okay?
1, 2, 1, 1.
Great. Yeah, all the visual fields were good.
Good. And so now we're going to test your strength a little bit. If you could raise your left arm in front of you just like this, just straight out, and then hold it up there while I count to 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. Great, and you can put that down. And then lift your right arm up for me the same way and hold it while I count to 10. 2, 3, 4, 5, 6, 7, 8, 9, 10. Great, you can put that down. If you could lift your left leg straight up for me while I count to 5, hold it there. 2, 3, 4, 5. Good, you can put that down. And then same thing on your right leg. Lift that up and hold it up there. 2, 3, 4, 5. Great, and you can put that down. Now we're going to check your coordination. Nikki, could you check finger, nose, finger for me,
you bet.
please?
So I'm going to have you do is touch your nose with your pointer finger and then touch my pointer finger. So go ahead and, start with that hand. And I'll have you reach out. We'll do this a few times. One more time. And we'll do the same thing on the other side. Good. Great. I'm going to do the heel shin. So what I'm going to have you do is take your heel and put it up on your kneecap and then go ahead and draw a line down and up. And do that a couple of times. Great. And we'll do the same thing with the other foot. So take your heel and put it on your kneecap. Great. And up and down a few times there. Great. Yeah.
All right, thank you. And then Nikki, could you actually check sensation for me too, please?
Yeah, you bet. So John, what I'm going to do is I'm going to take this pin here and I'm going to test your sensation. So I'm going to touch your arm here with a little, does that feel sharp?
Yep.
And I'm going to touch over here, and does this feel the same to you?
It does.
Okay, I'm going to do the same thing on your face here. So sharp, and then over here, does it feel the same?
Yes.
Great. I'm going to do it on your legs as well. So I'm going to touch over here. Does that feel sharp to you?
Yes.
Great. And then over here. Does that feel sharp and does it feel the same?
Yep.
Great.
All right, thank you. And then we're going to check some things about your language. We have some cards for you to look at.
Yeah. Right. So I'm going to have you can go ahead and hold on to these cards. Can you tell me what you see in this picture?
Yeah, so there's a woman washing dishes, the sink is overflowing, and then it looks like 2 kids behind her are trying to steal cookies from a cookie jar, and the step stool the boy is on is starting to tip over.
All right. Now I'm going to show you a few pictures. I'll point to them, and what I want you to do is tell me the name of them. You can hold on to the cards.
Glove, key, a cactus, a feather, chair, a tree, and a hammock.
All right. I'll have you go ahead and read these out loud.
You know how, down to earth, I got home from work, near the table in the dining room, they heard him speak on the radio last night.
And I have one more card for you. Have you go ahead and say these words out loud.
Mama, tip top, 50-50, thanks, huckleberry, baseball player.
Great.
Great, and then we're going to just check one more thing with your sensation. Nikki, could you check for extinction for me?
Yeah, you bet. So what I'm going to have you do is close your eyes. I'm going to touch one arm and then the other. Tell me which side I'm touching. Okay, so go ahead and close your eyes.
Right, left, both, right, left, both, both, left, right.
Great, thank you. So your exam right now looks normal, which is great. But based on your description about what happened, I think you might have had something called a transient ischemic attack, or what some people might call a mini stroke. Since your symptoms have completely resolved and you're back to normal, I don't think there's a specific treatment we need to give you right now. But I think we should do some more testing to figure out what happened and how we can prevent something else from happening like that in the future. I'm going to talk to your emergency department physician on the phone, and they'll come back in a few minutes to discuss the plan going forward in a little more detail. Do you have any questions for me before I go?
No, not right now. Thank you.
Okay, thank you.
When caring for a patient with suspected stroke, be sure to stay in the room during the Telestroke consult. Determine your organization's standard with placement of the Telestroke cart in the exam room. This is usually either a few feet from the end of the bed or at an angle to the side. The goal is to allow the Telestroke provider the most unobstructed view as you're assisting with the exam. You may need to relay some results to the provider, such as the visual field assessments, since this requires you to be directly in front of the patient. When completing the NIHSS, efficiently move through each section. This will minimize door-to-treatment times. Have your supplies handy, including the picture cards to assess language. The NIHSS instructions suggest using a safety pin to assess sensation. Some organizations do not have pins readily available or have prohibited their use. In that case, you can use your hands to check light touch sensation or break a tongue depressor or wooden swab at an angle. Do keep in mind that the broken swab or tongue depressor may be less sensitive and can become blunted with use. The NIHSS is weighted towards anterior circulation stroke and does exclude some deficits, such as balance and dizziness. As such, the Telestroke provider may ask you to perform additional assessments on or off camera, such as walking the patient. Be sure to ask clarifying questions to the Telestroke provider if it is something that you're unfamiliar with. The patient is a 45-year-old male brought in by EMS. They report he's unable to speak, has right-sided weakness, and sensory impairment. This was witnessed by his daughter, who called 911. The EMS crew brought him directly to the CT scanner, and his head CT was completed. The read was normal. We'll join the case now as the Telestroke provider begins the consult.
Hi there, I'm Dr. Wheeler. I'm a stroke doctor at the University of Wisconsin. The emergency department physician has asked me to look at you over video today to help figure out what's causing trouble for you. Is that all right? Okay. Can you tell me what happened to bring you into the hospital today? Tim, can you tell me what month it is this month? What month is it?
Yeah.
Okay. How old are you?
Yeah.
Okay. Close your eyes for me. Close your eyes. Good. Can you make a fist? Make a fist. Make a fist.
Make a fist.
Good. Very good. Then look straight ahead. Can you look over to the right? Look to the right. Look over towards the right. Good. How about the left? Can you look towards the left? Look over towards the left. Good. Very good. Nikki, can you try to help us test visual fields?
Yeah. All right, what I'm gonna have you do is look right at my nose and tell me when my fingers are wiggling. Yeah, he was able to move his eyes to all 4 quadrants.
Okay, great. Tim, can you smile? Smile and show me all your teeth. Can you show me your teeth? Like this? Smile? Good. Can you raise your eyebrows? Raise your eyebrows. Good. Can you close your eyes really tight? Squeeze your eyes tight. Good. Can you lift your left arm up for me, straight ahead in front, and hold it up? So lift up your left arm. Nikki, could you help lift your arm and see?
You bet. Maybe
So
hold
lift your arm up and hold
and
it
hold
up.
it. Hold
Keep
it.
it up.
Great.
2, 3, 4. Great. Keep it up. 6, 7, 8, 9, 10. Perfect. You can put that down. Good. Can you lift up your right
You
arm?
want to try lifting this up? We'll lift it up, and hold it up there.
Hold
Hold
up
it,
there.
hold
Keep
it,
up
hold it.
there. Okay. Can you lift your left leg up and hold it up? Lift up your left
Lift your leg. Lift this leg up. I'll help you here. Lift it up. And can you hold it?
Up there.
Hold
Keep
it.
up.
Hold it.
2, 3, 4, 5. Good. You can put that down.
Can you
How
hold
about
this
the right
one up?
leg? Can you lift it up and hold it? Lift it up and keep it up. 2, 3. No. Okay. Okay. Let's see if we can try to test for coordination. Nikki, could you try finger, nose, finger?
Yeah, you bet. What I'm gonna have you do is use this finger, and touch your nose, and then touch my finger.
Good.
Great.
Good.
Can you do that over here?
Okay. Okay. Let's try a heel shin.
Okay. What I'm gonna have you do is take this heel and put it on your knee. So I'm gonna help you here. And then run a line down your shin, just like that. Good. You do that again?
Good.
Okay.
Very good.
Can you lift this leg up at all? Yeah, no.
Okay. Okay. And let's check sensation if you don't mind, Nikki.
You bet. I'm going to touch you with this pin. I want you to tell me if it feels sharp over here. Does this feel sharp? Does this feel sharp? Yeah, I don't think so.
Could we try maybe nail bed pressure?
Yeah, you bet.
Okay.
You seem to grimace to that. Do you want me to test
How
the
about on
other?
the other side? Yeah, great.
No, no response there.
Okay. Okay. Okay, great. And then I'm not sure the cards will work, but let me ask, Tim, can you repeat things for me? Try to repeat some words for me. Can you say mama? Say mama.
Yeah. Yeah.
Okay. Can you say tip top? Tip top?
Yeah. Yeah.
Okay. Okay. And let's try extinction, Nikki, to just finish that up.
Yeah, you bet. I'm gonna have you close your eyes. Can you tell me which side I'm touching? Go ahead and close your eyes. There you go. Can you tell me which side I'm touching? Yeah.
Okay. Okay. All right. I'm going to talk with the physician on, and he'll come back with a plan here in a minute.
Thank you.
All right. Thank you.
This case highlights adapting the NIHSS for the patient who is having difficulty speaking or understanding what is being said, creating a communication barrier. If the patient has trouble following commands, it is acceptable to demonstrate or pantomime assessment elements, such as making a fist. Likewise, it's okay to verbalize words during the language assessment to see if the patient is able to repeat after you. With dysarthria, when assessing articulation of speech, it's beneficial to ask family in the room if the patient's speech sounds normal. If you have the ability, discussing the patient's baseline status with family is particularly useful. During the motor and ataxia assessment, begin with the non-affected side. You may need to assist with lifting the affected limb to the initial position for assessment. And that way, you can see the true level of weakness for a patient who may be confused or experiencing neglect. Ataxia is assessed with both the finger-nose-finger and heel-shin test. It's noted only if it's out of proportion to the amount of weakness in the extremity. That completes the NIHSS assessment. It is helpful to practice the NIHSS with your peers to ensure you're familiar with each component of the exam and what a normal exam would look like. For further information or questions about this education, please refer to the information on the screen. Thank you.